Welcome back to the Health Suite. Today we have Dr. Baskaran, a consultant paediatric neurologist. Tell us a little bit about yourself.
Good morning. So as you just introduced, so I'm a pediatric neurology consultant, and I've been a consultant for the past 3 years in Leicester, and I deal with children who have problems with headaches, seizures, epilepsy, developmental delays, neuromuscular problems where they have difficulty doing motor activities like getting up, climbing stairs, and we find out why they have these problems and treat them.
So there's a lot of really important issues and conditions you've raised there. Let's break those down a little bit. So tell us a bit about children with epilepsy.
Yeah, so epilepsy can be very scary for parents. So it's important to make a diagnosis earlier. If children have seizures without any reasons, for example, it's very common for children to have seizures with fever, especially in the young age, which is called febrile seizures. Usually children have a normal development, they don't have any other associated problems, and they have a short seizure and they're fine after. And the fever goes away and they're fine, they're perfectly fine, the whole life goes well. It doesn't affect their development. But there are certain times where without fever or without low blood sugar or without any injury to the head, they can have seizures again and again. And these seizures can happen at any time of the day, night, while sleeping, during daytimes. If children tend to have seizures again and again, at least 2 or more seizures, and if it's continuing to happen, and then we think about a diagnosis of epilepsy, this basically means that the brain has a tendency to have abnormal electrical activity which fires and causes some kind of short circuiting in the brain, which causes children to have seizures. Most of the seizures are quite short and they settle by themselves if it happens, but it is important to start medications by doing an early diagnosis so that we decrease the chances of having further seizures and they can have a normal life. The idea is to give a normal life for the child.
That's very important. And what kind of diagnostics might you use to help confirm epilepsy as a condition? So
history taking is the most important thing. I'll go back to the most important thing. So when I say history taking, I need to get as much as information from the parents. So it'll be very helpful if a parent is about to come and meet me in the clinic for a concern of seizures happening, trying to tell me what happens before the event, trying to observe the event, like look at the face of the child, the hands of the child, the legs of the child, as to what is happening in the whole body. Trying to have a note of time if possible. I know it's a very panicking situation. It might be very scary to see, but it'll be helpful to know all these things. And trying to know how long it goes on for and what happens after. Is a child perfectly baffling himself or herself, or is there a drowsy state after? And trying to know how often it happens. So is it on a weekly basis, daily basis, on a monthly basis? So that information, along with we get a full information about development, birth, and the whole history. If that information is provided, that helps in thinking about a diagnosis of epilepsy. Now we have gadgets, so everyone has a smartphone with them, and if it is safe to do so, again, if there's an emergency, you need to call 999.
Yeah.
But if it's a short-lasting episode which is happening multiple times, which is sometimes quite often the case, the children have funny turns, parents see it for a while and then they're fine, they're back to themselves, and they are like, okay, let me wait for an appointment, they meet their GP. So in those circumstances, if it's possible, take a video, and then if it's a non-emergent situation, video I'm talking about, in a safe way so that you cover the whole child from head to foot. And bringing these videos to the clinic would be a supportive tool for me to look at along with the history, and then examine the child fully, and then think about a diagnosis of epilepsy or not. So there are many other conditions which can mimic epilepsy.
And do children need any other testing apart from the history? Do they need any scans or?
Yes. So based upon the history and examination, then we make a decision whether we need to do further tests. So we do a test called electroencephalogram. It's a medical term, sorry. It's a brainwave test, basically. So it looks at the activity of the brain. So I think many of you might be familiar with ECGs on the heart. The same way we put sticky stuff on the head, like probes, and then it monitors the activity of the brain. That gives information about what's going on. So it's usually a 20-minute test. That's how we start with. If needed, we might do a 24-hour, 48-hour test if it's needed, if we have doubts. And then comes scanning the brain. So if there are certain types of seizures, what we call as focal seizures, like one side of the body alone having seizures, we are quite worried if there's something happening in the brain. Is there a tumor in the brain? Is the brain formed differently? Is there something else going on in the brain? So we might have to do a scan to find out if there's anything wrong in the brain, which will require sometimes in younger children some sleeping medications to achieve the scans, but older children we should be able to achieve without that.
And are there any other conditions? So people talk about funny turns and seizures. So how do you tell these apart?
Yeah, it's a very important thing, and that's one of the commonest reasons why everyone gets referred to neurology. So there are a list of things. So, for example, even syncopal attacks. You might have heard of fainting episodes. So that's one of the commonest things which they present with. So children can have what we call as fainting episodes because they have not had their breakfast and have been on a summer day standing outside or playing. They've been dehydrated. And sometimes even painful event, for example, or emotional events. For example, putting a needle in your hand, you can faint, don't you? So similar kind of emotional events can make them have a fainting episode. Even in a fainting episode, because in a fainting episode there's less blood supply which is going to the brain. After you faint, you might have a few jerks in your hands and legs.
Yeah.
It might look like an epileptic seizure, but again, getting a careful history and delineating between a syncopal attack and an epileptic seizure is quite important, because this gets treated differently.
So I guess it's a lot more common for it to be a funny turn than it to be true epilepsy then?
Absolutely. Most of the times, yes, that's the case.
Sure, that's very reassuring for all of the parents then.
Absolutely, yeah.
No, that's fantastic. Thank you very much. I kind of think this is a really important topic that people want to hear about and understand a bit more about the impact. So thank you very much. Thank you.
Nice meeting you.